Hello everybody, my name's Lance McCarthy and welcome to my latest video diary. I've had the pleasure of spending a little bit of time this afternoon with three of our fantastic specialist palliative care team. So Caroline, Louise and Charlotte. So Caroline, can you just talk me through how the specialist team works and the support they can provide both to our staff and to our patients?
Yes, thank you. So we are a team of nurses, nurse specialists, senior team of nurses and consultants, both from who are based here and at St Clair's Hospice. And our aim is to support the ward teams in managing patients with specialist palliative care needs within the organisation. So we know that nationally, about 30% of the patients who are in hospital at the moment will probably die within the next 12 months. That's a national figure. We know within the Princess Alexandra Hospital that the figure may be slightly higher. So maybe even in some cases up to 50% of the patients may not be here in 12 months' time. So one of the key things that we want to achieve is recognising that people may be in the last year of their life and then being able to support them to be able to do what matters to them within the last year of their life. So we look at things like how to manage their symptoms, if they have any. We also look at what they want to do or where they might choose to be when they reach the end of their life. We look at what's important to them in terms of their family and how best to support them, not only physically, but psychologically, emotionally, spiritually. And as I say, we link in very closely with our local hospices. So within the team, we come from a very diverse background. We've got nurses who have worked in the community, within the hospices, within our own geographical area, within pain team. Lots of us came from intensive care, critical care backgrounds. And as well as Jane Hegarty, who is our regular consultant here, we have three consultants who come and work every week from the hospice, from St Clair's. So we've got really strong links with St Clair's and Isabel Hospice, and we just want to make sure our patients get the best care possible.
Fabulous. And you talk about the hospice there and the strong links that we have with the hospice. I think it's a bit of a misconception that the hospice just provide inpatient support. Federally, they provide a whole range of services that obviously you can help support, link the patients into. Is that correct?
Absolutely. So a large part, obviously a lot of our patients go home from Princess Alexandra, and we link very closely with the community teams who support the patients in their own home, as well as the family support services. They also have a living well service. I know that us as an organisation are working very closely with the hospice in terms of providing extra support for frailty patients as well as patients who we know have a life-limiting illness. The hospice is a fantastic resource, and it is really our intensive care unit for specialist palliative care.
Yeah. Nice way of putting it. And then finally, before I come on to Louise and Charlotte, so there's obviously some gold standards in terms of how we can support our patients to the best effect. And as you would expect within NHS service, there's an expectation of what excellent looks like. Could you just talk me through that as well?
Absolutely. So if we're going to provide all these services and link patients in with the services that are available, what we have to be good at is recognising when people are in that last year of their life and directing them to the services that are available. So we have launched since last September the Gold Standards framework on 3 of our wards, and we're hoping to roll that out across the organisation in the next couple of years. And the Gold Standards framework really is about early recognition of patients, to be able to have those conversations with them. What's important to them? What do they want? Do they understand what's happening? And how best we can support them and and prevent them necessarily from coming into hospital. Someone in their last year of life has 365 days or less of life to live, and we want them to be able to spend as much time as possible doing what they want to do, not sitting in our hospital beds. So linking in with those with those services is really important, and of course a huge part of what we do, because being a small team we can't do everything. End of life care support for those patients is largely with the managing teams, with us to support them, and a big part of what we do is educating those teams to be able to recognise when people are potentially in that last year of life, and how we can best support them.
Yeah, fabulous, thank you. Yeah, 365 days, if you think a 3-day admission is pretty much 1% of the rest of your life, that's a significant chunk, isn't it?
Yes, it is.
Thank you. So, Louise, perfect segue in there. So, you've had a lot of experience working in a whole range of different parts of the health and social care system, and a lot of experience in the community. And you're now our lead educator. So, can you just talk me through the support that you provide to our colleagues so that they can support the delivery of the gold standards and support all of our patients as they're coming towards that last year of their lives?
Yeah, so my role essentially, so I have lucky because I have a dual role essentially. I work 3 days a week providing education, and that can be in many different ways. So I would essentially, I plan a lot of the education that we provide across the trust. So we look at, the national frameworks, we look at the ambitions for palliative care and how we link what we do every day into that. So we're providing, like Caroline said, really, really good standard of care. So I plan a lot of the education, I teach a lot of the education, but ultimately my job is really to go to the wards and just look at how we can educate people. So we do it in a variety of ways. It could be that we put on study days. So we do a study day quarterly, which is a specialist palliative care study day. So it looks at really complex symptoms, looks at ethical implications in palliative care, looks at advanced care planning. So it touches on a variety of things, and that's open to registered nurses and doctors across the trust. But then we also offer bespoke training to the wards. So I strongly encourage the ward managers and any of the nurses to kind of touch base with us if they've got, if they've had a complaint, for example, or they're struggling with a certain area within palliative care or end of life care. We like to be able to, arrange our bespoke training for that ward. It could be around symptom management and around the way in which we deliver symptom management, like syringe drivers. So we would put on training for that. We also provide training for new inductees into the trust. So we provide induction training for registered nurses and also healthcare assistants. We provide monthly simulation training, which we do in the Learning and Development Centre, and that looks at people attending the training, and we look at cases, so sort of not like scenarios where we can watch other people having difficult conversations, and we do a lot of reflection on what we're seeing and our own practice. So it's a really good way, it's a really excellent way of kind of looking at what we're doing and how we can improve what we do, and getting some feedback from our peers. We also run a programme of training with St Clair Hospice. Our consultants here have arranged training that the CNS is a part of, where we run different study sessions for FY1s, FY2s, IMTs. So looking at communication, recognising dying, which is a really important part, and then complex symptom management. And we also provide some of the training for the new doctors that come in, a little bit around kind of how to refer to us, what our role is, and how we can support them. So my role is very much around kind of looking at strategically the education that's needed, but also taking into account the the national framework and kind of what we should be doing as a trust to kind of get to gold standard, really.
Blimey, not much in there then, but really importantly helping colleagues understand what palliative care, especially palliative care support is, and
absolutely,
how that support both them in their understanding, but also importantly patients.
Yeah. Yeah.
Brilliant. And you mentioned there about how to contact you. So how, if people want to contact you, either to refer patients in, or because they've got a query about understanding palliative care, or they want some other support, how do they do that?
Yeah, so we we have a triage nurse every day in our office, and we put that in place because we wanted to be accessible, not only to go and see patients on the ward, but also to be able to give advice in a really timely manner. That's really important when someone's quite unwell and the doctors are struggling or the nurses are struggling on the ward. So they can make referrals to our team. We work 7 days a week. We work 8 till 4. We have a palliative care CNS on triage every day, so they can contact us via Alertive, and we're somebody on the phone every day between 8 and 4, and they can ring in here and speak to one of the triage nurses and just discuss the referral. Sometimes it may not be appropriate for us to see the patient. It might just be that they need to know what's out in the community and what's available, and we can absolutely signpost them for that. And we work weekends, so we work 7 days a week, 8 till 4. Christmas Day, we're on, and we're here to kind of support the ward teams and our patients and their families.
Fabulous, thank you. And Charlotte, clinical nurse specialist, supporting and obviously supporting our patients overtly.
Mm-hmm.
Talk me through some of the things that you would do on a day-to-day basis to support our patients.
So after morning handover, the triage nurse will sort of allocate patients to us. There's always, we try and always have a nurse on the end of life role, so just seeing patients who are in the last days of life, who aren't necessarily symptomatic. It's just that extra support for the family and the ward staff and the patient. For more specialist patients, we would find out what the focus of care is, what the team need us for specifically. It could be a range of different symptoms: pain, nausea, vomiting, agitation, and we can go up and support the family and the team. A lot of the time it is about supporting the family's emotional needs as well, the patient's emotional needs. They might just have had bad news broken to them. It's a very scary time for families and patients. And what we like to do is kind of help facilitate conversations that people find very, very difficult. I think a lot of us go through life maybe trying to push these thoughts away about the fact that we're going to die one day. And then when it happens, families don't always know how to communicate about that with each other. So that's a huge part of our role, is the emotional and psychological side of things. And it's about reading patients quite quickly, because a lot of people maybe don't want to talk about advanced care planning, especially not on the first time you've met them. It might just be us introducing the service and what we're here for, and kind of planting a seed about, we can help you with this if you want to have those conversations. It's always going to be the patient's wishes. If they don't want to have those conversations, we're not going to push that, but we just want them to know that we are there to take that with them, if they want to, which most people actually do. I've worked in this job for 3 years, and I haven't had many patients who have been in complete denial. Less than 5, I'd say. So, most people actually do want to take these conversations forward.
Yeah, sure. So giving them space, giving them time to reflect, and then being able to be there to support them from that. And obviously plugging them into lots and lots of other services that both PAH provides, but actually are also provided by others in the community as well.
Yeah, exactly. I think when people hear the word hospice, it's a very, very frightening word for people, because to them it just means end of life, very end of life. But actually the hospices provide a really fantastic service in the community, for emotional, psychological, symptom management support, and actually they help people live their lives in a much better way. So it's just about reframing the narrative about what hospice care is. It's not just a building, it's a model of care that's a supportive model.
Yeah, absolutely. And obviously by doing that, obviously supporting the patient holistically, but importantly supporting their relatives and actually supporting colleagues in the organisation to enable them not to have to worry about these things, because we've got colleagues who've got specialist skill sets and knowledge to be able to do that. Well, fabulous. Thank you. Thank you all for your time today, but much more importantly, thank you and the wider team for everything that you do to support our patients, their relatives, and all of our staff on a regular basis. Thank you.